These are being designed as randomized controlled intervention trials. And it's called the PAVE study. And at first I saw this, periodontitis and cardiovascular events. That should be PACE, but it's not. They as we talked about earlier, the operative word is vascular, it's vessels, so they call it the PAVE study. It's an NIDCR funded study. The pilot study, 400 patients, 5 treatment institutions, it's now finished. It's unreported. The last data entry was June of this year. It's supposed to be reported out, I believe, the second quarter of next year. Some of the investigators that were there and with the study did have a little table clinic and they talked about it. The results, although it hasn't been really tabulated yet, but I can tell you that the results they got are going to be statistically significant. The half that had treatment had better outcomes with respect to their cardiovascular disease than the half that did not. And it was a strong association between the two. As a result, I think this has been bumped up. Supposedly this is supposed to start in summer of '07. The full study is going to be 4,000 patients in 15 centers. As far as I know, this will be the largest dental study in the history of dentistry. I've never seen one that had more than 4,000 subjects. It is going to be a 5 to 6 year study, and it's going to be interesting to see how that plays out. The other interventional study is, I think, probably even more interesting, and it's the Boston study that's being done now. And what these guys are doing is, again, they're taking 2 groups. They're trying to control them. Everything's randomized. It's a smaller study, and it has 100, I believe it's 170 subjects, 160 subjects. And what they're looking at is the initial injury to the vessel. Everybody remember the endothelial dysfunction. That's the first thing that occurs. It's like periodontal disease. If you get to it early enough, you can reverse it. So what they're doing is they've got this patient population. They all have periodontal disease, and they're all showing signs of early cardiovascular disease. So they're treating one half, and they're not treating the other half, and they're seeing if not only will they remain stable, but can they reverse those early signs of heart disease by treating them for periodontal disease. This is a fairly early study on this as far as early results. Their results are going to be published in '09. I think they're supposed to finish their data entry in '08. But that one will be very interesting. So what is the conclusion of the bulk of the well-run controlled studies? Conclusions: most of the well-run studies that are statistically sound, and that's the operative word here, show a 2 to 4 times increase in the odds for CVD if you have untreated generalized periodontal disease. So, why is this information important? We talked a little bit about that. I think patient education is extremely important. Again, Bob Anderton's going to talk more about this and what we can do. But if you can educate your patients, that of course is the number one thing we need to do. We need to be the people controlling the information going to the patients, not the makers of Listerine or the Houston Chronicle. One thing that I'm doing, and if y'all are interested in this, I'm putting together a lot of the literature, the data that I've got into a patient information booklet. I'm going to have it ready at the November 17th meeting. If you want them, let me know how many you want, and we're going to have it printed up. I do have the AAP information, little brochure, but to me, it's number one, out of date. Number two, it's written on a 3rd grade level. If I got that, I would be offended. Patients are too smart to get some of the stuff that we give them sometimes with the written literature. So I'm getting this ready. This should be ready on November 17th. If you'll let me know if you're interested, I'll give these to you. On the 2nd page, there will be a one-write type carbonless piece of paper. And it'll say periodontal disease and your health was presented to patient name, by, and date. So at that point, the patient's pretty much up to date. It's up to them whether they read it or not, but then you tear that carbonless piece of paper off and you put it in the patient's chart. So that patient at that point is fully informed. If a patient refuses treatment or a referral, I think they should sign a statement that the periodontal disease, systemic disease link was explained to them. Standard treatment protocol, always initial therapy followed by pocket reduction or elimination, will become a medical necessity. Follow-up assessment, maintenance or recare. And I think it's real important, again, I think y'all are seeing this is a common underlying theme. Report to the patient's physician the periodontal status. And I think physicians should report back to us. One of the little parts of that magazine from Scientific American, they had several topics. And the bottom one says, blurring the doctor-dentist barrier. The barrier we have between our two professions is, I think, artificial. I mean, to assume that the mouth has a wall around it and nothing happens in the human body as a result of the oral cavity or vice versa is pretty idiotic. And I think it's an artificial separation that I hope gets broken down, because there's a lot we can do to help patients that they can't do and vice versa. What do I think the future holds? This is where I get to do the crystal ball stuff. I think we're going to be watched to see how we respond to the emerging interventional data. I think that goes without saying. I think we will work closer with physicians, and I think physicians will appreciate more what we can do for their patients. I hope this one doesn't occur, but the old pocket elimination at any cost to zero pocket depth may become necessary. The old apically positioned flap and inch-long teeth and gingivitis. I really hope that doesn't happen. Extraction of any teeth that don't respond to periodontal or endodontic therapy, maybe holding on to teeth, nursing them along is not the best thing if this data looks like it's going to look. Chairside test of inflammatory mediators, high sensitivity CRP. Some periodontal research teams are looking at this as a way of assessing the effectiveness of our periodontal therapy. May or may not be something we see in the future. Insurance coverage for periodontal procedures transferred to medical, perhaps. This has already happened. More complete dental coverage for patients with systemic disease linked to periodontal disease. I don't know if you're all aware of this, but Cigna, on certain of their policies, is now paying 100% of periodontal treatment for patients that have diabetes. If it's an expectant patient, they're paying 100% of their recare, of their maintenance. So that's something fairly new. And the next would be, unfortunately, I think this is going to occur because I think we're targets. And I think Bob, again, is going to talk more about that. He's got a lot more data on that. He keeps track of all this stuff. But the incidence of litigation against dentists, if they have a target, it's going to be there. Again, I would like to let everybody know that if you want to do the meeting on the 17th, please let us know, because it is probably going to fill up pretty quick. He usually sells the house out. So he's a good speaker, a good guy, and I think y'all really enjoy hearing him. Any questions? Anything anybody got?
I just wanted to know, it was probably a little less than a year ago that I looked on the American Heart Association website, and
Yeah.
there was nothing. They had all these things on what can cause, risk factors, and had nothing on periodontal disease.
Mm-hmm.
I'm really surprised at that.
Yeah.
And I don't know about the American Diabetes Association, but I know that one. And I haven't looked at it recently, so I don't know if they've
Yeah.
changed it.
Yeah, it has been changed just recently, but there's quite a bit of reluctance, I guess you could say. But again, if you'll notice, most of these articles, most of these studies, I mean, it looks like there are hardly any periodontal run studies at all. There are a few, but especially the cardiologists have really bought into this big time. The fact that inflammation is a very important factor in vascular disease. So, we'll see. Yeah. Any other questions? All right, well, thank y'all for coming. If you're still hungry, keep eating, because if you don't, I have to take it home.